Okay, this comes from many different sources, but from Forbes, new guideline advised disclosing cannabis use before surgery.
Mm-hmm.
Now, again, we've talked a little bit about this before, and talking to Dr. Greenspoon and Dr. Goldstein about these things, they both agree with this situation here, though. But in the United States now, all patients undergoing procedures that require anesthesia are advised to disclose their cannabis use before surgery, according to new guidelines by the American Society of Regional Anesthesia and Pain Management. The guidelines, which were first related to the use of cannabis prior to surgery, also note that regular use of cannabis may worsen pain and nausea after surgery, increasing the need for powerful but addictive opioid painkillers. So that's kind of, I'm not surprised by this information really, but at the same time, it kind of does make me think twice about this. Does this mean because I use cannabis for pain, that if I go and have a surgical procedure, am I going to actually need stronger opioids after surgery? I don't really know, but that's what the article seems to be alluding to right now. So before surgery, anesthesiologists should ask patients if they use cannabis, whether medicinally or recreational, and be prepared to possibly change the anesthesia plan or delay the procedure in certain situations. Now, the delay they're talking about is, it comes down later in the article, and I'll go ahead and drop that bomb right now. They're talking about if you show up to have surgery and they find out that you're high, that they shouldn't operate on you. So
Wow.
it kind of makes sense in a way, because I know in the United States, they require you to sign a consent form before surgery, and you're supposed to be, you know, in your right
Are they
mind.
gonna do the same thing with other medications, or is it just cannabis they're fucking telling you not to do here? Like,
Well,
if you
right
show
now,
up and you've taken a shitload of Vicodin or something, would they be like, "Oh, that's cool. We'll still do surgery on you"?
well,
I suspect
I can guarantee you. Yeah,
if you're high on that shit, that they'd probably say the same thing.
yeah.
We got
When
to
you go in for
reschedule.
pre-surgery down here, Mackie, they pretty much tell you which drugs you cannot have before surgery. They'll ask you, what do you normally take? And they say, okay, you can't have any of this.
And that's fine, you know. Just expect equal treatment for our Mary Jane. That's all.
It is. I mean, it sounds like the article is actually pinning down cannabis, but I don't really think that the article is so much blaming cannabis for being bad as just saying that, hey, we need to start treating it like every other medicine we're using here. Say medicine president, who is his name? Samer Narose, and I know I butchered that. ASRA pain management president said in a statement from the Organization of Anesthesiologists and Pain Management Professionals, they also need to counsel patients about the possible risks and effects of cannabis. For example, even though some people use cannabis therapeutically to relieve pain, studies now show that regular users may have more pain and nausea after surgery, not less, and may need more medications, including opioids, to manage discomfort. So, you know, they're basically saying here that just because you use cannabis to relieve your pain doesn't mean that you're not going to feel really horrible after surgery. And that kind of makes sense, you know? And I know in the United States, we have a patient-doctor confidentiality policy here, that what I discuss with my doctor about my health and my medical practices is my own business and his, and he has to keep it between the two of us, and that's just the way it is. So you can in the United States, and I don't want to encourage everybody because I don't know your laws in other countries, but here it's not legal for a doctor to say, hey, he's using cannabis, you need to arrest him. No, that's my business between me and my doctor, and that's my health, and that doesn't go anywhere. If it does, there's an issue. So in the United States, don't be afraid to talk to your doctors, is what I'm trying to say right here.
Part of that Hippocratic oath or something, isn't it?
It is do no harm, but also here it's part of there's a law called HIPAA that makes my medical privacy a federal requirement by law. It's actually, they passed a law that revealing any bit of my medical history, I can sue you and you're in big trouble, and doctors can lose their license for that. So you are protected, and that's a good thing, because you know, especially in areas where medical cannabis is not yet legal, and we know that those areas have people who do use cannabis, even though it's not quote unquote legal, but it helps them. But they still need to talk to their doctors and explain that they're using this, because cannabis can affect many things, and especially if you're going into surgery, it's going to affect the way anesthesia works on you. The article goes down further down and says that anesthesiologists need to know if you're a heavy cannabis user, because it may require more anesthesia to keep you unconscious for the entire procedure. So I
Mhm,
definitely
mhm.
would not be wanting to wake up in the middle of a surgical procedure. So
And not even that, not even like wake up, but sometimes people, there's a specific name for it as well, because it happens more often than you think. Don't want to freak anybody out, but
Well, I know
people
what you're
can
talking about.
seem like they're asleep, but they're actually awake and they can feel all like they're playing with their organs and shit. That
Oh,
doesn't
great.
sound cool, man. Listen to your anesthesiologist, motherfuckers. It's an important thing. You know, if he says don't smoke any weed, don't smoke any weed. You don't be fucking going through none of that shit. That's a bad trip. That is, damn.
Right. Yeah,
Oh,
the guideline recommends that anesthesiologists ask patients about their cannabis use, frequency of use, how much they use, which type of cannabis they use, and when they last used the medicine. The recommendations also suggest that the healthcare providers postpone elective surgery if a patient arrives for the procedure under the influence of cannabis. So, wow, I can't say anything bad about this. I know if I walked into the hospital drunk, they wouldn't operate on me, right?
yeah, that's very
So
true.
one of these things. It's pretty normal, but it's a good article. I saw it, and it definitely said that this is something that we need to reiterate here, that this cannabis is medicine. It's not something you need to hide from your doctor at this point. The new guidelines also suggest that frequent heavy cannabis users be counseled on the potential negative effects, such as controlling pain after surgery. Pregnant patients should also be informed about the potential effects of maternal cannabis on the fetus and newborns. They noted that patients who regularly use cannabis might need more anesthesia to fall asleep to keep them from waking up. Heavy cannabis users could experience more agitation during surgery. Definitely don't want that, flinching. Oh, Lord. Potentially leading to the need for more monitoring during recovery and delayed discharge from hospitals. A discussion before surgery can help the anesthesiologist provide the adequate, appropriate level of pain control while helping the patient understand the risks. So this is all new here in the U.S. That they're finally starting to move cannabis into mainstream medicine, I would say. So this is a promising thing, but all of our listeners, if you're a medical cannabis patient, please talk to your doctors. They need to know.
Yeah. For many reasons, not just the anesthesiologist thing, but the CBD with the medications that work with the liver and shit like that. We spoke about it before. It's not harmless. There can be side effects if you're not careful. So
it is a medicine. We know this, and it does. You can call it a drug if you want. Go ahead, it's fine. But we know that it does do certain things. We just don't know everything it does. And because of the federal guidelines that we have here for so long, not being able to test things, we really don't know everything about interactions right yet.
Yeah,
So by all means, be open, be honest, and listen to what your doctor tells you about this stuff. If you're going into surgery, you got high blood pressure problems or diabetes, if you have regular medications, your doctor needs to know your health practices. So
there's a good point there as well, which you make it that the tests haven't been done because it's been illegal for them to do so, and it still is federally illegal, right?
They've recently rewritten some federal laws that allow them to do more testing at the federal level now. It's not completely removed all the way, but yes, there are able to do more tests now. But you can imagine it's going to take a really long time before people want to jump into this. I mean, we've talked to other doctors, and they've told us over and over again that when you do cannabis right now, that some doctors look down on you, like, you're touching that? So it's going to be a while before, I feel like, at least cannabis becomes normal in medicine.
Yeah.
And until then, we just got to do what we got to do.
Indeed.
But, I use it on a daily basis to control pain. It works really well for me, but I'm just going to have to fit that into the rest of my life, So guys, talk to your doctors.
Indeed. Don't be shy.
Nope.
So I have
imagine.
Sorry, Bubble, you got something to say there?
I was going to say, can you imagine going into your meeting with your anesthetologist or whatever it is and having to outline every strain and every type of cannabis you smoke?
But I smoked this 23% one this morning.
Yeah, just come in with like a 3-ring binder, just sheets of paper.
Bubble walks in with these vials of rosin. He said, well, I had this one this morning. I had that one last night.
And that one was 20 minutes ago.
I'm about due for this one here. So no, I don't really think that they want to get that in depth on it, but I guess, if they really wanted that information, I could give it to them. But do you really think that everything that you've ever bought from a dispensary or a legacy person, for that matter, is actually what they say it is?
It's just
I've had questions several times about stuff I've gotten. Like, this can't be right.
anesthetics is complex, man. You know how dentists have to go to medical school for longer than doctors do, and that's because of the anesthetics that the dentists have to use, man. They only deal with the mouth, really, the mouth and the throat, but they have to learn shitloads about anesthetics and how they work on people, and that's why it takes them so long, and why medical school is so long for a dentist, apparently, allegedly. But it's a complex thing, man. They still don't quite know how anesthetics works on people. He just knows that it makes people sleep and not be able to feel pain for a while. So it's complex.
Rusty Nails in the chat was saying if they need to know the strain, it proves they don't know what they're talking about as far as cannabis. But you know what? That's a true statement. They really don't know what they're talking about cannabis right now. So that's the reason they're asking these questions,
More research needed. And again, the reason why we have these problems in the first place is because the government are ignorant bastards and have kept this shit for illegal for too long. It's a farce, man.